So here is the results. So interesting finding from the predisposing factor, which is to evaluate their knowledge, attitude, belief toward if the program are able to increase in their attitude toward sexual abstinence. And the thing we found out here is that the one I have circled on is that the importance that the compared to comparison group, those people who say that they are willing to wait, the importance that the person you marry not have a sex until marriage, actually the statistics significant, and it shows that the pre-adolescent attitudes about sexual abstinence actually increase after intervention. And for the enabling factor, the interesting found out is that if they willing to talk to their parents, or they are able to talk something on the TV, radio, and then if they have a good communication with their parents, they are more likely to increase their attitude toward, after the intervention, more likely to increase their attitude toward abstinence. And then for another reinforcing factor, actually interesting result is actually it's also consistent with the literature, shows that those who actually are smoking and drinking, and actually they are, after the intervention, they did not increase their attitude towards sex, abstinence. And on the other hand, those actually peer pressure did have a lot of influence on for example, they try marijuana, those close friends, actually, if their close friends are willing to wait until marriage to have a sex, then they are actually more likely to increase in their attitude toward abstinence. So then for the long-term impacts, and then the interesting finding is that those children's intention to remain abstinence and until marriage actually positively affect their pregnancy avoidance. And then for those children who actually they self-reported they ever had sex, actually their increased pregnancy avoidance at 12 months. So in other words, that those who actually already sexually active, they already have sex, but they are, after the intervention program, they will be trying to avoid having sex. So, and then that's the significant findings. And then for another long-term impact is that family rule, like if your family has existing rule that from the parents that tell parents where you are, actually family rule actually influence children's pregnancy avoidance. And then we also found out similarly to other findings that compared to Hispanic children, white children increased pregnancy avoidance by the intervention. So here is sorry that I run so fast. So and the cost benefit analysis, actually the cost basically we consider is what money was put into the program. So this consists about the curriculum development, pre-course survey, post-course survey, follow-up evaluation, and this was actually summarized by the cost per pre-adolescent. And in terms of the benefits, we consider that the benefit from direct effects from the program itself. So which was through those statistical analysis and multi-evaluation statistical analysis, we found out there is the direct effects. But for the indirect effects, we consider those are found to be the variable that found us to be statistically significant, predict those three factors at the 12 months follow-up, which is we look for the long-term impacts. We derive them, which we calculate in terms of their indirect effects. But one interesting thing is that because some kids already in this age, if they are sexually active, they were more likely to use the condom after the interventions. So, but we all know that the contraceptive method may have a failure. So there is a variety of literature shows that there is a birth control pill may not work. They don't know appropriate use. So based on one of the study, I use contraceptive failure rates to calculate that. So in order to get exact numbers. So here so basically to summarize cost effective of the school-based health education program, we use the total actually number that was reported by themselves in terms of their likelihood of the sexually abstinence, and then compared to the net gain by pregnancy avoidance at 12 months. And then using this, I calculate the monetary value of a pregnancy avoidance per student based on the school-based health intervention. So here comes a number. I know it's really difficult to read, but I will try just, yeah. Yeah, so just let me give you on the top is the direct effects, which is direct from the program, and the total growth, and I also use those predictor that's significant predict the programs, and then it's calculated their indirect effects. So the total growth effects is about 1,353 children pre-adolescent per 900 kids. This is projections. And then for the calculated total cost, actually, I use the birth control failure, and then to estimate that how much if the failure rates, and then calculate that the projection of a number of unintended pregnancy pre-adolescents, and then calculate how many adolescents really we save, and then we found out that actually if you spend $1,000, we can save 13.67 pre-adolescents. And in terms of the cost part, because we spend about $73 per adolescent, but by deducting all those costs, actually the net gain is about $20.46. Yeah, so in other words, that the program did work and it's cost effective. Thank you very much.